In terms of dealing with those thoughts, I think, again, it's okay to have them. I don't necessarily push them away just because you're having them. It's okay to have that stuff cross your mind, because when you're diagnosed with cancer, that's the stuff that it brings up. I think, sometimes it's helpful as well. So if you're someone who's going through treatment and treatment maybe isn't going so well, or it's not clear, how treatment's going to go, or maybe it's even looking like, this isn't going to be a curable cancer, you're maybe not going to survive, then those thoughts are kind of natural, and they're possibly even going to be helpful, because when you're in that space, sometimes there's things that you need to be able to think about and prepare for, that are going to help you to be as in control of the situation as you can be. So when I work with young people, I never have it on my agenda to bring that stuff up unless it's, already kind of on their plate for them. I think we generally try to be where the patient's at in terms of where their head's at and what they're thinking about. And at the same time, we do try to make a safe and a comfortable, respectful space for it to be okay to put that stuff on the table, because I think in our experience, when it isn't clear how treatment's going to go, when it isn't for sure that the treatment's going to work, or that the young person's going to survive, it can be helpful to think about some of these things, not just to help the young person survive, but to help them to make the most of their time that they have, and to help them to be able to talk to their friends and family about the stuff that's important to them. So I think it's important sometimes to listen to those thoughts about death and dying and mortality. They can help us take us somewhere useful as well.